Welcome to Charter California Edition. I'm Brad Pomerantz. Thank you for joining us. On this half hour, we'll be speaking with Don Knabe. He is a Los Angeles County Supervisor. We'll be speaking about the success of LA County's Safe Surrender program. But first, we are joined by Ted Lieu. He is a member of the California State Senate. And sir, I want to speak with you about the rollout of the Affordable Care Act, also known as Obamacare. I have to say that I think a lot of folks, including myself, were somewhat surprised by the number of individuals that signed on to the various websites for the healthcare exchanges.
There has been this huge pent-up demand for healthcare coverage and healthcare access, and you're seeing that happen right now, and it's very exciting that millions of Californians will now be covered under the Affordable Care Act, whereas before they could not have gotten this health insurance.
And what's so compelling for those that support the Affordable Care Act is it's not just in your blue states where folks are calling. Kentucky, for example, has almost as many filed applications as California in the first few weeks of the Affordable Care Act. Kentucky, I mean...
If you're uninsured, it really doesn't matter where you live. You want to have health insurance. You want to be protected in case anything goes catastrophically wrong. And it simply makes good sense because we already pay for healthcare costs. If you're not insured and you're sick and you walk in the emergency room, all of those who have health insurance are paying for you to get treated. So this simply makes good sense.
At the same time, we do know that in the early weeks, there were some technical glitches on a variety of the healthcare exchange websites. Not just California, but apparently the federal website, healthcare.gov, had some real serious problems. What do you make of that? Were we not ready for prime time, or what's your sense?
Well, I think with any massive rollout of a new program, you'll have some technological glitches. However, California did fairly well in its very first week. It signed up over 30,000 people, which is very impressive. And keep in mind, this is a really massive undertaking, and it's brand new, but Covered California has done a fantastic job so far.
But are you surprised by the interest? Because I guess what surprised so many people, including me, is that polls leading up to October 1st, when the exchanges went live, indicated that a lot of folks really didn't understand the Affordable Care Act and didn't really know what an exchange was. So you had this kind of cognitive dissonance where no one really understands it, but yet hundreds of thousands of people are going on the website.
So there's been a series of misconceptions about the Affordable Care Act. When you actually do polls asking people about different components of it, do they like the fact that an insurance company can't deny you if you're pre-existing coverage? Do they like people who can get covered until they're age 26? If you ask all these questions,
specific elements,
everyone says yes.
It's
just when they hear the term Obamacare, sometimes they have a negative reaction to it.
But what was interesting to me is not so much the kind of positive negative on Obamacare, but just the mere knowledge of what it does, and that you can go and sign up for a healthcare exchange. You know, those numbers were very low. Not whether you favor a healthcare exchange, but do you even know about it? And yet there was high demand. I mean, most of the glitches were because they didn't expect so much traffic.
That's right. There are too many people signing up. And you're right. When you say healthcare exchange, it's hard to know what that is, but direct someone to a website, go on coveredcalifornia.com, and you just walk through it, and it's very easy to understand what it's doing.
I do want to ask you, though, and I don't know if you know this answer. I don't think anyone knows yet. But the reality is, in order for the healthcare exchanges to be successful, the mix of people signing up can't just be weighted towards the elderly and the infirm. That will cause what Republicans are saying is a death spiral. So do we have a sense as to whether we are seeing a mix of old and infirm as well as healthy and young?
It's a little too early to tell, but keep in mind the way the Affordable Care Act was drafted. If you intentionally choose not to have insurance, you're going to have to pay a penalty. And so that should drive everyone to get insurance if they don't have it.
And let's talk about the penalty, because that is a source of consternation for some, and actually a source of consternation, I'll say, for most, but for different reasons. Some folks would say, how dare you penalize me if I choose not to have health care? Well, the Supreme Court said the government can do that. Others are saying the penalty's too low. I mean, in the first year, the penalty is $95 or 1% of your income. It's not a lot of money.
So for those who intentionally choose not to have health insurance and don't want to pay the penalty, I would simply say it's not fair for you to go get treated then at a hospital, which will happen, and all of us are paying for you to get treated.
Sure.
So I am perfectly fine with imposing a penalty on you because you should pay for that treatment.
What about it's not high enough? I mean, at this stage, $95. I mean, how much is a plan? It's more than $95.
Now, it may not be high enough, but when you take a look at it, most folks actually want health coverage.
Yes.
And it was an affordability issue for many. And for many, there was a pre-existing condition issue as well. When you take those two things out, we should have a pretty big pool of people signing up.
What about for the healthy and young? Because I think a lot of them are, at some level, are willing to roll the dice. But when I talk to people, and I will say, you know, if they're in their 20s, well, you look toward a catastrophic policy, which means high deductibles. It's just in case something happens. Are those available?
Absolutely.
Okay.
And in fact, the Wall Street Journal had a very good article saying you had some young people being able to buy insurance for $62 a month. In California, it would be a little higher than that. But if you're young,
so that's
you can
just,
buy catastrophic coverage for fairly inexpensive
And that just
amount of
means
money.
if, you know, for some, you know, godforsaken reason, you get in a car accident, you get cancer. But it's just simply for those what ifs.
That's correct. Now, depending on how old you are and sort of how many members you want covered,
but I'm thinking of like those that are, you know, they hit 26, they're not 35 yet, you know, they're not worried about well visits or gynecological exams or whatever it may be, they're not getting pregnant.
They can absolutely buy a relatively inexpensive health insurance.
Now let's talk about the Medicaid expansion. Here in California, it's known as Medi-Cal. Many states, about half I would say, have refused to accept the Medicaid expansion. Ironically, those states have the highest uninsured rates, but be that as it may, we've accepted the expansion. Do we know how that is going in terms of those signing up? Because I would have to think that those that would qualify for it may have low knowledge about it.
It's still too early to tell, but one of the reasons I authored Senate Bill 353, which the governor signed, is we know that for the 6 to 7 million people in California who currently don't have health insurance, a majority of them are in limited English proficiency
And tell us about that bill, please.
So Senate Bill 353 requires health insurance plans when they send out the marketing materials to the various ethnic communities to translate the core documents into those languages.
So this is not only for the exchanges, or is it, well...
So this is for all health insurance plans. Their insurance exchange also has their own rules, which basically are going to do similar things.
What about the Medicaid element? Because you still, as I understand it, if you call Cover California and it winds up that you really would qualify for the Medicaid expansion, you'll get transferred.
Right.
But does this bill protect those that are...
So this applies to health insurance plans.
Okay, I understand. So if you want to apply for the Medicaid expansion, you go to your county? Is that how it's working now?
That's one way to do it. Another way is these clinics that are set up will simply help you fill out whatever form is required when you walk in there as well.
So how is it going in your district, for example? I mean, you represent 900,000 people. That's
ridiculous.
Bigger. That's bigger than some states. I mean, literally.
It's actually now nearly a million. Totally ridiculous.
Yeah. So, are you hearing much?
So my district office is not hearing very much because it's going relatively well for the scale of this program. And again, Covered California has done a relatively good job. It's different than a federal website. And I'm pleased with what they have done. And there's still going to be glitches along the way, but the general thrust of this is a lot of people are going to have health insurance coverage, and that should actually bring down the rates for all of us because we stop having expensive payments for folks who walk in the emergency rooms without health insurance.
What's interesting about Cover California, I know they're aggressively marketing. They have campaigns in some scripted programs. They're running a video contest to attract young people. I mean, on so many levels, they really are trying. I've seen commercials.
Absolutely. And a lot of it is targeted at some of the younger generation because they may not know about this benefit they can now get for a very inexpensive
His name is Ted Lieu, member of the California State Senate. When we come back, we'll be speaking with Don Knabe. He is a supervisor in Los Angeles County. We'll be talking about a safe surrender program that has gone extremely well in this Southern California region. I'm Brad Palmer, and Just Charter, California Edition. Welcome back. It's Charter California Edition. I'm Brad Pomerantz. Our guest, Don Knabe. He is a supervisor in Los Angeles County. And sir, since I have known you, I know that one of your most significant passions has been the county's Safe Surrender program. It launched in 2001 as a result of your efforts. And the last few months have been nothing short of inspiring, I have to say, in terms of safe surrenders. What exactly is the program, by the way, before we get into it?
Well, first of all, safe surrender is basically no name, no shame, no blame. Where a mother, within the first 72 hours of birth, has the ability to go cross the threshold and walk into any hospital in Southern California, any fire station in Southern California, and turn the baby over to the proper authorities.
That's simple.
That's simple. That's simple. The baby gets immediate medical attention. The mother gets medical attention.
If she so chooses.
So chooses. Otherwise, she can leave.
Right.
The baby and the mother each get a little band with identification because there's no names involved. The mother has 14 days to reclaim the baby. That's happened once out of the 110 saves. That mother making that courageous decision to cross the threshold is a big deal. So when you see these babies and had the opportunity to interface with them, you realize they're this close to, a lake, a river, or trash can, or dumpster, or whatever it may be.
In the last few months, we saw the 107th surrender in Pomona, 108th in Los Angeles, 109th in Van Nuys, 110th in Lancaster.
Phenomenal, but the point being, and part of the expansion of the program is in between those, we had the passing of a baby. And so we realized we still have work to do.
In South El Monte, there was a death. The baby was found, and the baby was deceased. And so the good news is, though, is you're getting the word out. Obviously, if you're having 4 surrenders, literally those 4 surrenders were in less than 2 months.
In less than 2 months, we've had 7 for the year. So you can see it does have an impact. And even in the tragedies of a baby losing their life or being unsafely surrendered, we usually have surrenders after that because there's media attention.
Literally,
to the bad news.
Yeah, I mean, I think
in the meantime, we've had the press conference for the new program.
Right, and I think it was right after the press conference to announce the sad passing of the child in South El Monte 3 quick surrenders.
Well, yeah,
it's hard to know the timing, but be that as it may. Okay, but let's talk about the good news. You had this press conference to announce that First 5 has provided a grant. Is that right, sir?
First 5, as some know as Prop 10, First 5 is a preschool. It is, they granted us a grant of $500,000 to expand our program. We've had some other entities get involved, but First 5 was the key player in all of this to allow us to go in multiple languages to sort of recreate, as I would say, recreate the Safe Surrender program, sort of refresh the faces, put a firefighter out front there, still have the basic logo, but the whole message being there's a better choice, safely surrender your baby.
And the languages in which there is a focus, English, Spanish, Korean, Chinese, makes sense given the county that we live in, but that's not exclusively the languages you're
No, because our hotline 24 hours a day, 7 days a week is, there's 147 different languages spoken that they'll be able to hook up with. So, that's the primary. But we're doing it, we're increasing the outreach, not only community groups and other, faith-based organizations, but we're putting, our posters up in laundromats, parks, bus benches. We've got Clear Channel, which has expanded our billboard program.
Yeah, Clear Channel, of course, the billboard company with
CBS
radio.
Outdoor. Right.
Recently, the Long Beach Press-Telegram ran an article so touching. I mean, it literally brought tears to my eyes about a 4-year-old whose name is Adriana. What can you tell us about Adriana?
She's a special little girl. Again, she's one of the 110, and I've had the opportunity either at the 10th anniversary or various birthdays, and we, just the celebration to interface with these kids, and they just break your heart because they're such a joy. They've been given this incredible opportunity because a mother has had the courage to submit the baby, to surrender, but then these families waited with open arms, and the joy it brings to their families, not to the big sister, to the little brothers, whatever it may be. And you just see that, and it just breaks your heart.
And we know very little about Adriana's birth mother, but what we do know is she was homeless. And to think that someone who was facing such tremendous odds, tremendous challenges, she delivers, and yet she somehow had the presence of mind on February 11th, 2009, or within 2 days of that, to hand over this child. I mean, it really says so much about this woman, of course, but just the human spirit generally.
Well, yeah, it says a lot, but it also speaks to her courage, and even though she's homeless and a lot in her mind. I mean, the thing hard for everyone to realize is that, you know, these women are getting, it's not preteens, it runs the gamut in age, but they're getting pregnant in secret, they're hiding their secret, then they want to throw away their secret. But in between all of that, even in their desperation, 110 mothers have had the courage to make the right decision for that baby. And that's what's so inspiring about the moms. Then you see the families that greet the baby with the open arms, and then you see the joy of the kids. I mean, it's just, it takes...
Beautiful. I mean, Adriana is just beautiful, and the parents couldn't be happier. And I have to think that Adriana, when she grows up, will feel something special happen to her, you know, and I don't mean to use such a simple
word. It will. I mean, I think, you know, a lot of them don't know at this point what happened. I mean, the classic, which is always hard for me to tell the story, is that at the 10-year celebration, one of the little girls, she had to be like 6 or 7, comes up, grabs my leg, and she says, "Mr. Kanabe, my mom told me to tell you thank you, and you'll know why."
I could almost start crying right now. I mean, it's really touching, and I'm wondering if there's anything we can do to somehow support the Safe Surrender program, just as viewers, as Angelenos. Is there anything?
Well, I mean,
we can do?
I think first of all is to get the word out, or I mean, whatever groups or organizations you're involved in.
Right.
We can help do that. The numbers out there. I mean, even in desperation, we have the 1-877-222-9723.
We'll have that on the screen, of course.
But I mean, even in desperation, people can dial 211 and to be able to hook it up.
Right. 911, 3, whatever it takes.
Whatever it takes, it'll happen. And so, I mean, the whole point being of this new campaign is there is a better choice.
Right.
Safely surrender your baby, and it's just a matter. I mean, because you don't have to just always cover the good news.
Right.
You have to cover the bad news as well too, and covering the bad news helps those mothers in desperation maybe make the right decision.
And I have to say this, when I drive by fire stations, I see those signs. I mean, they're very prominently displayed, the Safe Surrender logo signs.
Right.
So the message is getting out there, and I'm sure that these firefighters, medical professionals have been trained to handle these delicate situations.
Well, they have, but you know, they have their own emotions. Even at the press conference, we had some firefighters there that had rescued some of the kids. The classic was a few years ago, now she's 9 years old.
Right.
Baby Tessa was the first one I ever got to celebrate a birthday. And for her first birthday, the family brought baby Tessa to the fire station in La Mirada where she was surrendered. And the paramedics got to see her for the very first time. You know, because they do their job.
Right, of course.
Comes in, baby take, you know,
Call
run to
social
hospital,
services.
you know, boom, boom, boom. Never to be seen again. And it was a very emotional day for all of us.
I can only imagine. How do you feel knowing that because of your efforts, that Safe Surrender has not only been propelled throughout the state of California, but has permeated throughout the entire nation? I mean, the program's pervasive.
Well, I think, unfortunately for me, I want to say unfortunately for the deaths of the baby, but to be at the right place at the right time and so moved by baby Andrew being found in a dumpster.
That was the impetus behind this.
There is a lady, and her name is Debbie Ferris. And Debbie Ferris, to me, is the epitome of an advocate. You know, and
is she the one that has the cemetery?
She's the one, but she's also the one that went to the state to create the Safe Surrender law, which Senator Jim Brulte. But no one knew about it, and she didn't have the ability to do it. And you know, somehow we all got together a year later, and the rest is history. But Debbie Ferris, and then that. I don't know if you've ever been out there, but the Garden of Angels, which is a cemetery for these babies to give them, proper recognition and some dignity in the passing.
Do we know if this young child from South El Monte, is he going to be at the Garden of Angels?
Well, we don't know yet.
Right. I can only imagine the wealth of emotion that you feel as you hear about these safe surrenders. To have 4 happen within 2 months, it's got to be incredibly gratifying. And I just have to say thank you. Thank you so very much.
I appreciate that. I've got a great team. Every time I'm notified of one way, I just say, "Yay, Team Kanabe."
It's that simple.
It works.
His name is Don Kanabe. He is an angel himself, if I may say. He is a Los Angeles County Supervisor. We'll be right back on Charter California Edition. Welcome to California Edition. My name is Brad Pomerantz. It's my honor to introduce you to Lacey Kelly. I've admired her work for quite some time. You may know her as the host of Cox Civic Connection on Cox 3, also on YouTube. But her day job is actually the Chief Executive Officer of the Association of California Cities Orange County, known as ACCOC, which is what? It's a mouthful, first of all. But what is ACCOC?
We are a 501c3 educational nonprofit corporation,
right,
and we're a membership organization of Orange County cities, but also other government agencies, private industry, higher education, and community-based organization groups.
And when I think about Orange County, you have some beautiful cities. It's 28 cities, is that right?
34.
There are 34 cities, so 34 cities in the whole county. I should have known that, but I forgot. That's okay.
That's okay.
But some of California's most beautiful cities, Newport Beach, Anaheim, there's so many up and down the coast, and even inland as well. I mean, Yorba Linda's beautiful, and so
absolutely.
Tough job you have.
Well, actually it is, believe it or not.
Of course. So why did the ACCOC, why was it founded?
That's a great question. Well, we used to be a subset of the League of California Cities.
Right.
And they are a lobbying organization for cities within Sacramento.
Right, and we know that well.
Yeah,
yes.
and as such, you know, there tends to be more of a one-size-fits-all kind of model. There's not a lot of customization in public policy. Our cities leaders and different government agencies in Orange County believe that the best public policy and solutions are from the ground up. They're customized to the local community, to the residents there, to the topography, and all the things that impact the local communities.
Right.
So we're what we call a from the ground up public policy organization.
And what's so interesting about your model is that I so often am amazed at how an individual can be elected as a city council member in a significant sized city. Anaheim, Santa Ana. I mean, these are big cities, 300,000, 400,000, 500,000 people, and yet there's no real training ground for them.
Right.
I mean, the league has some training, but like you said, and this is no criticism of the league, they're focused on Sacramento.
Right.
And so it seems like what you're doing is really focusing on helping elected officials become the best that they can be.
That's absolutely right. We're an educational organization, and you have different folks getting into office who have different objectives when they get into office. Doesn't mean they have the knowledge about all the myriad of different issues they're going to be dealing with. Transportation, housing, parks and recreation, all of those things.
So let's talk about Orange County specifically.
Sure.
What are the issues that are really percolating right now? What's on your agenda?
Sure. Well, funding is a huge issue. We're working on local government innovations, in other words, trying to maintain services to residents with less resources. Transportation is a huge issue.
OCTA,
homelessness is a huge issue. Those things we're working on. Just jobs in the economy is a huge issue. Cities want to know, how can I help stimulate business in my city? How can I remove barriers
and it's
so that they can succeed?
That you mentioned the question of economic development, because as you know as well as anyone, cities had this phenomenal tool, arguably, called redevelopment.
Yes.
And I know many Orange County cities were using that tool to their advantage to help revitalize blighted areas and to serve as a catalyst for larger developers to come in. But that tool has been eliminated.
That tool has been eliminated.
And so I have to think you're incredibly involved in trying to shape the new world of economic development.
Yeah, well, again, it's at the state level, and there isn't a lot of impact that we can have other than giving our feedback, which we do. We are weighing in on the new tools that are being developed, but there's not a lot of detail right now on what those tools are going to look like. They've really taken away enterprise zones, redevelopment, everything.
Did Orange County have enterprise zones?
We had a couple,
You did, right.
Santa Ana and Anaheim.
Right, but what's interesting about the new enterprise zone law is that arguably it could apply to more areas because now it's focused on tax credits for R&D. So, but it's a new world. I mean,
it's a new
literally
world.
Since the ACCOC developed. I mean, on the question of economic development, things have completely changed.
Absolutely.
I have to ask you about Disneyland.
Okay.
I mean, I just must, because what an economic driver that region, I mean, it really is a region, has. Talk to me about Disneyland and the importance of it to the entire Orange County and, frankly, Southern California economy.
Well, yeah, first of all, let me just step back and say I'm not really authorized to talk on their behalf, but
no.
I can tell you a few things.
No, I know that. But what I'm getting at is, I don't mean, on their behalf, but just the question of, because look, you're working to make Orange County a better place.
Well, yeah, well, they're the largest employer in Orange County, and
is that true?
Yeah,
That is.
they are, and I think
more than the county.
I believe so,
yeah, I think you're right.
Yeah, and I think sometimes there's a tendency to look at them as an Anaheim company,
right.
But I mean, you know as well as I do that they're a worldwide company. But we have residents from all over the county that like to go and spend a day there with their families, and they do kind of cater to the locals, so they give them a discount to be able to go often.
Right.
And it is a fun place to go.
And what about in terms of jobs? Because if you, like you said, it's such a huge job creator, maintainer. How important is it? I mean, really kind of.
Well, any large employer is important, including some of our universities, and that's where traffic and travel and those kinds of things. Even cities work together on signal synchronization. You know, you don't know necessarily what city boundary you're going over when you're in traffic. You're just in traffic.
Of course.
So all of the local government agencies and businesses are working on those issues.
And let's talk about those universities, because there is no doubt over the last 20 years, Orange County's universities have really come into their own. I mean, when I was going to college, Chapman, I'd never really heard of it.
Sure.
It is now a go-to place. My niece just went through the college process. I mean, it is a go-to place.
Absolutely.
And I know, if I may say, you live right near Chapman.
Yeah.
And then UCI, another kind of sleeper school that is now incredibly competitive. Cal State Fullerton, one of the best CSUs in the area.
Largest business school in the nation.
See? Yes. So there's so much happening on the university side. How are cities, Irvine, Orange, and Fullerton, dealing with the kind of resurgence or surging universities?
I think that they're all really proud to have those entities in Orange County. We're working with two of those entities with Irvine.
Irvine, UCI,
we are working with them on a public policy certificate program for elected officials.
Fantastic.
Yeah.
Oh, well, terrific.
And then through the Mahalo College of Business at Cal State Fullerton, we have a program with them called Bringing Learning to Work, where we're doing some training with city staff, leadership training, to help them kind of benchmark and move up through the ranks in their own agencies.
You know, we think about Orange County, whether we're Californians or Americans, we have this sense that everything is sunny and bright in Orange County. I mean, it's the home of Disneyland, it's the home of Newport Beach. You surfers, you just can't go wrong. But you suggested to us that there is an issue of homelessness. And look, Orange County's done well during the recession. It wasn't as hard hit as some sister counties. But there are issues, and there is, there are challenges. I think about the Laguna area. You know, who would think that Laguna Beach and Laguna Niguel has the question of homelessness?
Sure.
And so talk about how you're working with cities to address the question of homelessness in a way that is compassionate, but still not detrimental to local business.
Right. Well, it's a tricky issue.
Right.
I was privileged to be on the work group that developed our homelessness plan for the county.
Right.
We're partnering with the county on that. Our county supervisors are engaged. The county is actually a member of ACCOC, and their Board of Supervisors chair is on our board, and he has been a real advocate for that. No, that is Sean Nelson.
Sean Nelson is now the chair. Terrific.
So each city is really, again, we believe in from the ground up local control, is really addressing it in their own way, but the key is to collaborate, and so that's kind of the function we're trying to play, is how do we get that collaboration between agencies.
And I do want to talk, I mean, I don't know, I'm sure you love all your children, all your city children.
Course.
That being said, I mean, there's got to be some competition among cities. You know, they're vying for the same economic dollars, sales tax, new businesses, and so how do we sing Kumbaya and make it one big happy family?
I don't think they see themselves as competitive with each other that way, but we actually start a little competition between cities.
Tell me.
We have the Golden Hub of Innovation Awards every year that celebrates how cities are doing business in new and different ways that saves the taxpayer dollars. And that is a way that we engage in friendly competition between cities, but really it's a best practice model. So all the applications we get, which were 50 last year for an award, we publish them all in a compendium so all of the cities can utilize each other as a resource. And that is something they do embrace.
Well, Orange County is lucky to have you.
Well, thank you.
Her name is Lacey Kelly. She is the host of Cox Civic Connection on Cox 3, and she's also the Chief Executive Officer of the Association of California Cities in Orange County. My name is Brad Palmer, so we'll be right back on California Edition.